Father Tag, can I welcome you to the stage?
Well, a tremendous pleasure to be able to join you. So I do work for the NCBC, the National Catholic Bioethics Center. In case you haven't heard of us, we're based in Philadelphia. I want to just jump right into our topic today. And I want to address some of the pastoral types of concerns. How do we discuss this? How can we be sensitive in the face of the challenge of infertility? What does infertility really mean when you encounter it at the heart of a marriage? The shock of infertility, one couple's comments I share here because I think they're fairly typical. We felt a certain sadness early in our marriage because we were reaching the point of realizing that having children was not going to be as easy as we had anticipated, and that ultimately we were not in control. So that sense of we can't just call all the shots here, that we're not in charge to the degree that we maybe imagined that we would be once we got married. The realization by a couple that they're unable to have children can feel like everything is lost. This really can hit right at the core of their shared life and intimacy. So this heartbreak, the pain of infertility, resembles the sadness of losing a child. It calls forth grieving for children never born, never conceived. And the pain from this, as you might imagine, can be intensified by seeing your friends and other family members conceiving and having children all around you. So this yearning for a child, we know how hard it can be to see the truth of the church's teaching. This pain of infertility can be so profound, it can cloud our vision and make us only focus on one goal, which is having a baby. It is good, of course, and natural, even instinctual, to want children. And so, the church will always reaffirm that this desire is a good desire. And the problem here will reside on the level of what kinds of means will be chosen to pursue what is clearly a very good, very beautiful, and natural desire that God has given to married couples. We have these advances in technology that create an array of temptations and new approaches that promise greater control and power over conception and childbearing. And it's probably worth saying right at the outset here that these options are rapidly becoming commercialized as well. And as we'll see, that ends up being a factor that works at times against a proper understanding of the ethics. In other words, we have what has been termed by some the infertility industry. While advances in technology are generally good, we cannot assume that what is technically possible is always right. So offering an explanation, for example, of why in vitro fertilization is wrong is unlikely to initially reach infertile couples who are desperate for a child. When couples face painful situations, it can be difficult for them to listen to reason. Their situation is not just a matter of knowledge or possessing or acquiring information. It can be unhelpful, I would suggest, or even insensitive if we just try to pour in knowledge about church teaching. The mind, meanwhile, better receives difficult truths when the heart has first been prepared. And so we want to say a few things here about possible ways to reach out and to touch the heart first. When the heart is involved, it needs to be addressed in a language it understands to help draw it towards rational discourse, towards understanding the reasons behind the wisdom of the church. So the language of compassionate love is the language that speaks to the heart that's in pain. We are called to journey with them and offer support. So walking with empathy, you and I can identify with another human being and empathetically walk with them on a journey. Now, sometimes you'll hear people say something like, well, if you haven't actually been in that person's shoes, there's no way you can understand what they're going through. But that's not really true. That's not the case. If that were the case, we really wouldn't be able to care for each other. It requires we sort of stretch ourselves and reach out in ways that draw us out of our comfort zones. But it indeed is possible, even if we're not suffering from the particular way that the person next to us is, we still have this opportunity to connect empathetically and share empathy. Empathy does not require us to have identical journeys, just the ability to put ourselves in the place of the suffering individual and realize just how difficult their journey is. So our Holy Father speaks often about how we need to accompany people in their life's journey, enabling them to grow in spiritual health and vigor. And this is a perennial challenge, partly because when all of us are as busy as we are, to realize that we have to carve out time to accompany, to be present, to be available, that can be a Herculean challenge, as they say. So I think all of us are of the mindset that we would like to protect our loved ones from harm, suffering, pain, and difficulty. And there's this saying, I wish I had a big yellow umbrella to keep all the rain out of your life. But I don't have a big yellow umbrella, so I will walk through the rain with you. That often is even better than having that umbrella. That accompaniment is healing. And in that same vein, I want to reflect a little bit on the beautiful reality of compassion. This term, this word, compassion, it's from Latin and French roots, com, with, and pati, to suffer. Interesting, huh? To suffer with. You often think of compassion as a kind of, well, you can be a little bit at a distance and you just feel sorry for somebody. But the reality is, when you really are involved with what they're going through, you yourself are touched. Your heart is transformed. So literally meaning to suffer with, to suffer alongside, to participate in suffering. So the importance then of mourning with those who mourn, as we're discussing here, when we're dealing with individuals who are facing infertility, there will be a kind of mourning. So often it's as if right at the heart of their marriage, there has been almost like a death, and they have to grapple with that suffering, that realization. If we're dealing with irresolvable infertility, that they'll never be able to have a child of their own, this can take indeed some significant work to process and grow through. Compassionate love can require few or no words, even if at times all we have to say is, I'm so sorry you are suffering so much. That accompaniment, that compassion is healing. All right, so at this point, I would like to invite Molly Hickey to come up, and she's going to share with us a little bit about her own journey with infertility.
Thank you, Father Tad. It's an honor to be here with you today. And like Father said, I'm going to be sharing a little bit of my own story and sort of a firsthand account of what this journey felt like for me. I have always wanted to be a mom. I think starting back when I was a little girl playing with dolls in my room, I felt this strong maternal desire. I became an elementary school teacher, and that was right away a perfect fit. I felt like I had a passion for kids. I felt like I was able to use some of the God-given talents that I possess. I loved my students, and I knew right away that I wanted to have kids of my own. A couple years into my teaching career, I met Ryan, who would end up being my husband, and we realized right away that we had a lot in common. We came from pretty similar Irish Catholic families, and we both shared a desire to have a family of our own. So on a beautiful summer day, we got married, and we took our vows very seriously, especially the part about being open to life. We were open and we were ready. So about a year into our marriage, it became clear that we would need some help conceiving a baby. And at that point, we would begin our journey through infertility that would take many years. And this journey was surprisingly difficult, and it was a journey that brought out many, many different emotions for me. The first thing I remember feeling was a real sense of isolation. I am blessed with a wonderful family and wonderful friends, but this particular issue was something that was so hard for me to share with other people. Somehow I felt like the more people that knew what I was going through, the more pressure it put on me. So it was something that I kind of dealt with on my own, which I think is true for a lot of women and couples in this situation. Another emotion that was really tough for me, I felt this incredible sense of impatience. Journeying through infertility can be so slow. I remember doing the math in my head, and I would say, if I get pregnant this month, the baby will be here by Christmas. Or if I get pregnant this month, the baby will be here by then. And month after year would go by with no luck. Another thing I felt a lot of was this pressure. I felt pressure from our family. Our wonderful, well-intentioned parents were just desperate for grandchildren. I also felt a real sense of societal pressure. First I got a job, then I got married. Wasn't having a baby what I was supposed to be doing next? I also felt an incredible sense of envy. I seemed to be surrounded by women having babies, friends' baby showers, our younger siblings having children before we did. And I'm ashamed to say that I would look at other women and say, I would be a much better mother than that person is. Or I deserve to have a family. We deserve to have a family more than that couple over there. I think perhaps the biggest emotion I felt was frustration. And I'll even say like frustration/confusion. I remember a specific day sitting in Mass and being so frustrated with my infertility and ultimately so frustrated with God. And I just didn't get it. I remember thinking like, why would God have put this maternal desire on my heart and then make it so difficult to be successful? And that was really, really frustrating for me. So about 4 years into this journey, I ended up getting pregnant, and it was twins, and we were so excited. And I remember thinking like, twins, this is just like, I've kind of toughed it out through this journey, and this is my reward, like 2 for the price of 1, kind of. I was so, so excited. But 16 weeks and 5 days into this pregnancy, I had a miscarriage, and our twins were both stillborn. A beautiful little boy we named Joseph, and his beautiful twin sister Grace. And we got to hold them and spend time with them, and our priest came to bless them. And they were perfect. Their bodies were just perfect. They were these beautiful, beautiful children. And it was one of the best moments of my life on the worst day of my life. But boy, was that hard. So now this loss and this sense of grief just like amplified all of these previous feelings that I had had. So now I felt more isolated. I felt more impatient. I was beyond frustrated at this point, And then I was also now filled with this deep, deep sorrow. So this grief and all these emotions kind of led me to a point of desperation and led me to a point where I felt like I would do anything to get pregnant again. And I would do anything to have a baby. And that's a tough place to be, because I think when you get to a point of desperation, then this temptation comes. And there's the temptation to sort of lose sight of what you know is right. And there's this temptation to lose sight of who you are as a person. But it's interesting because I know that God really was faithful to me through this whole experience, because even at this really low point in my life, I remembered a couple of things. God showed me a couple of things. The first was that God's timing is perfect and his vision for my family is perfect. So in my head, I had this image of this timeline of how I wanted things to pan out. I had to remember that God's vision for my family is so much better than whatever I'm dreaming up in my head. Another thing I had to remember is that having a child is a gift. It's not a human right. It's not something I'm entitled to. Having a child is a gift. And even if our, modern culture has forgotten that a little bit, it doesn't make it any less true. So I didn't deserve to have a baby because of my lifestyle. I didn't deserve to have a baby because of the decisions that I had made or my accomplishments or how financially prepared we were or whatever. Having a child would be a gift from God if and when that was part of his plan for me. And then I think ultimately, the biggest thing I had to just continually remember is that my worth as a Christian woman and as a wife and as a daughter, none of that hinged on my ability to conceive a baby. It was possible to have a full and really meaningful marriage and a full and meaningful life in Christ, really regardless of where this journey would end for me. Back to Father Tad.
Thank you so much, Molly. Wonderful. Kind of pick up on a couple of points. I think there are certain temptations that can come up when we're dealing with infertile couples. For us as Catholics in particular, we need to be attentive to avoid faulting these couples in various ways. We might say, why don't they have more courage and fortitude? Why are they letting this infertility get them down so much? Aren't they being self-centered when it comes to their own pain, we may say? Are they sufficiently accepting of the will of God? Patience and accompaniment are what we need, rather than that judgmental angle that so easily crops up. We may be tempted to become impatient with them, but instead of trying to bring them to where we think they need to be in terms of their personal virtue, we need to meet them where they are. So key. Patience is of the essence, and this means being willing to bear their burdens with them, and sometimes to proceed very slowly, very patiently. All right, so a few practical suggestions here. First, I think asking a couple empathetically about their suffering and, in a sense, removing our sandals and simply listening, letting them speak, share their distress, tell their story. Already that's a huge first step on this important journey for them, so they can break free of a sense of isolation. Allow them the space and the safety for sorrow and mourning. Couple more practical points. Encourage them to share what they have done so far to try to address their infertility. What have you guys done? Tell me about that. Let's talk about that. And then, are there others, maybe friends or family, who can witness to them, who have suffered in similar situations and who can share their lived experience of what it means to make either life-affirming or life-negating choices. People who have been down this path of infertility, and maybe, it came out ultimately in a good way, or they realized, boy, we made some big mistakes, and I'd like to help some other people not make those same mistakes. And then, are there diocesan or parish support groups available? I remember one time I was speaking in Virginia. I was speaking, I think it was Roanoke, if I recall. I had all the priests of the diocese present, was speaking about this issue. And one of the priests, during the question and answer, he put up his hand and he said, Father, I'm pastor at the biggest parish here in Roanoke. We're so big that we actually can have a support group for infertile couples. So we have infertile couples, one ministering to the other. And I think he said it was a monthly or bi-monthly meeting. And he said, once in a while, I, as the priest, I show up as well. I attend these meetings. And there's a lot of healing. There's a lot of renewal that takes place here. And it's a wonderful blessing. So sometimes that kind of ministry, if there's sufficient critical mass, as they say, becomes possible to make available. All right, so I think we also want to ask some of the spiritual questions here. What's happening spiritually? Where is our good Lord in all of this? Begin asking and discussing some bigger questions. How does the Lord speak to us through our infertility? How does he speak to us through our pain? There's a sense in which we as Christians are especially versed in this, the whole theology of the cross. We reflect on suffering all the time. We've been given special graces to understand and realize that God is at work, even in the midst of those hard, bitter moments that we encounter. We may need to discuss no, not right now, versus no, forever when it comes to infertility. And how, either way, infertility is our cross at this moment. Because when you're going through it, even if you're not sure if it's going to be irresolvable, it is a cross in that very moment that we must at times take and place on our shoulders and again turn to our Lord for his support and grace through this particular challenge. I recommend Mary's help here as well. I remember one woman facing infertility, she put it this way, I find it hard to pray for the miracle of a child. She had been infertile so long. So I pray first for the miracle of complete trust in the ways of the Lord, as Mary did. To recognize that, of course, the Lord has a plan for you, for your marriage, and for your fruitfulness. So also to seek specifically Our Lady's intercession. She understands what it's like to suffer the loss of a child, what it is like to sorrow and to trust God, even in those times when we don't fully understand. You remember how she said, how can this be, since I know not man? She didn't even understand how this could be. But if God is there with us, our confidence, our trust must be strong. Now, what about alternatives in the face of infertility? Discuss alternative approaches and options apart from IVF to achieve a pregnancy. This is so important. And so I want to ask you, which techniques would be okay for infertile couples to try? And how can we know which ones would be okay? So in other words, what is the key criterion for discerning whether a particular approach to resolving your infertility will be okay morally? Does anybody know what there's a key criterion here that's really helpful for us to be able to say, oh, that technique is probably going to be fine morally, while that one Clearly will not in the face of our infertility. Anybody care to? Yes?
Preserves the marital union in some way?
Okay, it preserves the marital union in some way, he said. This is true, good. Anybody want to add any further angles or nuances to that? Yes? Okay, something that's natural but not artificial. I think there's a better way perhaps to formulate it, because sometimes things will be artificial in the sense that, there may be drugs that could be used to help a woman ovulate. And they're artificial drugs, something like Clomid. But that's not going to be a problem per se, the fact that it's artificial. So what is it that's really key here? This distinction between replacing the marital act versus assisting the marital act. Really important. Anytime you assist the marital act to achieve its proper finality, that kind of approach is going to be morally okay. It's not going to raise any fundamental moral objections or concerns. But on the other hand, if you replace the marital act completely with a different act, like IVF always does, that does raise fundamental problems. You're no longer respecting the given order of human sexuality. So this is very, very helpful. I'd like to now ask you, think about techniques that would assist the marital act to achieve its proper outcome. How can you assist the marital act to achieve its, yes?
Determining the time of ovulation.
Good. He said determining the time of ovulation. So through charting of the woman's cycle, it becomes possible to gain added knowledge about when she is probably fertile. And of course, the couple could then time marital relations right at that point to increase the chance of a pregnancy. Excellent. How else can we assist the marital act? Yes. Excellent. Prayer is key, as we said. The Lord has knowledge of everything, including the fine details of our own physiology. Anything on the part of the man? We're always thinking about, infertility is sort of female-based, but it's not always the woman. A lot of times it's the man. Anything that one could do? Yes? Good. Surgery for a varicocele. So what does that mean? That means that sometimes on the testicles, there will be veins that are placed in such a fashion that they overheat the testicles. And when you have high temperature in the testicles, sperm number plummets, goes way down. So if you do a surgery, kind of reroute things a little bit there's this possibility that the sperm count will go way up and you will greatly improve the chances of a conception. Excellent case, excellent example. Yes? The environment that men may be in, whether there's hot tubs, the old proverbial boxers versus briefs thing, all of that can affect the local environment in which sperm are produced. So getting that right as well. Anything else? Yes?
There also could be some female issues like endometriosis or meiosis or something that needs to be addressed before she can conceive.
Okay, excellent observation. She said there can also be certain female issues like endometriosis, which may need to be addressed. If you remember what endometriosis is, it's a situation where some of the fragments that are lining the uterus break free and maybe are not lost with the monthly period, but will go retrograde and attach somewhere else inside the woman. And then these are hormonally active, these tissues, and they will throw her cycle out of kilter. And sometimes there may be ways in which one can identify specifically the place where this is occurring and resolve it. All right, very good. So we've mentioned a number of approaches like this. I want to mention something called FEMM, Fertility Education and Medical Management. And this is an approach that really looks at the underlying causes of infertility and seeks to address them. So it teaches women to notice important, specific biological signs, i.e. menstruation and ovulation, and understand why these signs occur and what they mean for their general and sexual health. It works to correct underlying conditions that may impede fertility and restore the body's capacity to ovulate on its own. So this is a kind of nuanced approach, and it will be tailored to each specific woman based on her situation. So I have a video clip here that I'm going to run where this young woman describes how positive her experience was in encountering FEMM and how it assisted her.
On and off, I just had some trouble with having regular period. When I found out about FEMM, they really care and want to get you to the other side. Last week I was here for my appointment and my doctor said, well, let's get you to your goal, which my husband and I are trying to get pregnant, and let's get you to that goal by December. Like let's aim towards that, and we're going to work towards that. We're going to try a few different things. Part of it was I realized that I didn't know a lot about women's health side of things that I learned in the class. I was surprised how small things like vitamin deficiency in one area can actually be the cause for like a lot of imbalances. You get personal attention, and also just the access and availability. Having that type of a connection makes a big difference.
All right, and so a similar technology or approach some of you may have heard of is also known as NaPro, or natural procreative technology. And I want to mention both of these together because, it sometimes geographically there will be an issue that you cannot find somebody maybe who does NaPro technology, but you'll be able to find somebody who does FEMM technology. And just being aware that both of these take a kind of patient-centered, custom approach to really trying to assess what is the underlying cause of the infertility. So this NaPro technology has been basically pioneered by Dr. Tom Hilgers, Creighton University School of Medicine in Omaha, Nebraska. And I have a video here where they were outlining his overall approach on a newscast in Ohio, and they gave a very nice summary of it here.
Now, from WBNS 10 TV, Central Ohio's news leader, this is 10 TV Nightbeat. Now from the Nightbeat, how new technology helps some infertile couples get pregnant the old-fashioned way.
Well, there is new hope tonight for infertile couples. The answer may be in some cutting-edge science that actually makes things simpler. Andrea Camburn has our Nightbeat Health Report.
Claire Marie Eppolite is living proof that miracles do happen. At least that's what Claire's mom and dad believe after enduring years of frustration, trying and failing to get pregnant.
I felt like my body had failed me, that I couldn't do what I was meant to do, and that I felt an emptiness and void inside myself and my heart that could never be filled.
Like millions of other couples struggling with infertility, Stephanie and Anthony Eppolite thought the in vitro fertilization industry could help. But after spending $25,000 at a Sacramento IVF clinic and no baby, despair set in.
There was no hope.
That all changed when they turned to Dr. Tom Hilgers, a clinical professor of obstetrics and gynecology at the Creighton University School of Medicine, who's pioneered a radically different but successful approach to infertility called NaProTechnology. With NaPro, women observe and chart their physical signs, which provide key insights into fertility problems. That information can then be combined with new surgical and medical technologies.
Well, NaProTechnology is a new women's health science that cooperates with the the human fertility process. It identifies what the underlying causes are and it treats it effectively. And it relies upon a natural act of intercourse to achieve pregnancy.
Research in Hilger's new medical textbook shows NaProTechnology's success rates 1.5 to 3 times higher than in vitro fertilization. The American Society of Reproductive Medicine declined comment until reviewing his data. But for a growing number of couples trying to start a family, NaProTechnology offers hope now. For more information, go to our website, 10tv.com, and click on featured links. I'm Andrea Camburn, Nightbeat Health.
When you see these kinds of wonderful technologies that are out there, you might say to yourself, well, it seems like if I go to a typical doctor, a typical OBGYN, and I say we're struggling to, get pregnant, that the first thing they would really seek to do is to identify the underlying cause, right? You would expect that. But a lot of times, that's not how it goes, regrettably. You go to the physician, they'll do a quick workup. If there's nothing super obvious, they'll say to you, well, look, you want a baby? Just go down the street there and pay them, and they'll make a baby for you. And I think, this is very unfortunate when the medical profession takes that tack, that approach, and sort of plays into, then, the infertility industry. This is really getting at the root cause that, in many instances, is able to be addressed. All right, so just to give a quick example here, PCOS is polycystic ovary syndrome. This is accompanied by diminished ovulation or a complete failure to ovulate. The root cause is unknown, and these individuals often have difficulty getting pregnant. Ovulation can be aided with drugs like Clomid or hormones like follicle-stimulating hormone, FSH, commercial name is Gonal-F, and this may require using ultrasound monitoring to be sure not too many eggs are maturing on the surface of the ovary. So the basic approach is that you would receive a dose and see, is this helping me to ovulate? And then do ultrasound monitoring. If it looks like maybe just 1 or 2 of the follicles are maturing on the ovary, then that's the appropriate time for relations with your husband. And sometimes, it'll take some adjusting to be able to do that. But this would be one example of what FEMM would use or what NaProTechnology as well might use. And, some of the other things that we mentioned as well, the surgical approach for endometriosis. What about if you had a woman who had a blocked fallopian tube, and you could do a surgery that would cut out the blockage, reconnect the ends of her fallopian tube together, and now she would be able to get pregnant because the blockage was removed. These would be the kinds of approaches that, again, assist the marital act and do not replace the marital act with some other kind of act. All right, so facing the hard case of irresolvable infertility. Let's say you've got the situation where you really have done due diligence here, and you've tried everything, and maybe in the process of investigating what was going on, you discovered that there's something really the matter. In other words, he has 0 sperm, or maybe she's, she just doesn't have any eggs, or it's impossible for her to ovulate. So you reach the conclusion that our infertility is permanent. This is a very hard moment, I think, for a couple to navigate. How should we think about this irresolvable infertility? Is our fruitfulness only able to be manifest by having a baby of our own flesh and blood? I think that's a key question here. Because a lot of times, I think the pressure is on, and the presumption is, that's the only way to do it. That's the only way to be fruitful as a couple. And certainly the church would say, oh, no. Fruitfulness is a very beautiful, very broad reality. You know, I'll just give you an example to think about. If I were to ask you, are your Catholic priests who have vowed celibacy, are they non-fruitful? I hope you'd all say, well, no, of course they're fruitful. There's a sense in which when you have the pastor of a parish and he has 500 families, those are all like his children. There is a spiritual fruitfulness here that is deep, profound, and real. This can help open a discussion. What does it really mean to be fruitful as a man, as a woman? And it'll raise questions like, what about being a school teacher? You know, if you're irresolvably infertile and you become a school teacher, you have a whole classroom of kids who are your children. And you have, you know, the maternal and paternal opportunities, as it were, to influence and support them. What else can we do to express our radical male-female complementarity? So let me just throw this open to you. You know, a couple that's infertile, they've determined they'll never get pregnant. What are other approaches to fruitfulness here? Okay, adoption certainly is a possibility. You know, in my family, I have 2 natural sisters, and then I have another 2 sisters who my parents adopted. They were Mexican-American, and they were sisters between themselves. And it was a wonderful blessing that, you know, my parents did this, expanded the family in this way. So I'm a big believer in adoption. When you realize you're irresolvably infertile, you may need to grieve and grieve deeply. But then these other options, these other opportunities for fruitfulness, these other invitations from the Lord present themselves. And we hope in God's grace we can take steps, generous steps at times, in some of these directions. Maybe, you know, something, if not adoption, maybe something like Big Brother, Big Sister, where there's outreach to those in the community who have lost parents who need mother and father figures. You know, I'll just tell you another story. The first parish that I was assigned to when I was ordained a priest was St. Patrick's in Falmouth, Massachusetts, right on Cape Cod. And there was this elderly Italian woman who I got to meet, got to know her. And she had always been infertile. Her husband had died when she was younger. But she became this kind of Italian teacher that everybody wanted to spend time with. People were coming from New Hampshire, from Connecticut to attend her class. She was like this big mother hen, you know, putting her wings over all of her students. And there was a beautiful, and still is, she's, believe it or not, she's 101 years old now, and she's still teaching Italian, and she is, you know, still this mother hen who loves and cares for her spiritual offspring, as it were. So the Lord, you know, you don't know what the Lord's plan is here, but it's always a beautiful plan if we're willing to say yes to Him, to whatever He opens before us. What does it mean to share then our maternal and paternal instincts in these new and beautiful ways? All right, so helping couples struggling with infertility at the end of the day, it is the plan of God that brings hope to infertile couples. And to the extent that we can help people to unpack this and to realize that the Lord has a broad vision here for us, will be an opportunity of grace and healing in the face of the difficult realization that infertility has been part of their path. All right, so with that, thank you very much. We will take some Q&A at this point, and Molly and I will both take questions.
If you have a question, please direct it to one or the other, or if you want, you can direct it to both. And if you do it to Molly Hickey, I will give her my microphone so she can answer. So let me, with that, open up the floor. Questions from anybody out on the floor? This gentleman right here.
Hello, thank you for taking my question. It's a broader kind of question. You mentioned about the way the medical industry might just try to offer an easy solution without really going to the root of the question. And I guess broadly speaking, it seems like that's a problem for the medical industry in general. And it tends to, well, it kind of shakes the foundations of trust that one might have in the medical industry. And I was wondering if, either of you, you who have gone through the experience of, possibly going through different doctors and so on, if you could comment on that, on, what kind of trust that we can have in the medical industry when it seems like they're just so willing to, look at the bottom line or offer easy solutions.
Excellent. I'm going to actually pass that over to Molly because she has some very interesting history of how she went to different doctors and how she made the choices about which doctor she would use.
Sure. I found that it was very necessary to educate myself and really advocate for myself when dealing with certain doctors. And also sort of shop around a little bit and talk to different doctors and get different opinions. My own experience was I got the advice from some Catholic doctors. Unfortunately, for some insurance reasons, I didn't work with a Catholic fertility doctor. I worked with just like a mainstream Catholic doctor or fertility doctor. But I was able to educate myself, learn a lot about NaProTechnology, get some different ideas, and then take that back to my doctor and say, I need your help. This is what I'm comfortable doing. This is what I'm not comfortable doing. But I think it's really important to advocate for yourself and not just kind of put your blind trust in a doctor. And then I also found it really helpful to get different opinions and in selecting a doctor, find someone that you felt like would really kind of respect your opinion. But it's a good question, and it's certainly difficult.
Yeah, and I mean, I think your sense that there's always this question with the medical profession about a kind of overall reliability. Is there going to be a tendency to do a shortcut at times, which, of course, IVF is. And I think a lot of times the answer is, unfortunately, yes, and especially in areas that touch on sexual morality. So I think when you have young people who are going to the physician, a lot of times the first instinct is, well, we've got to get her on birth control, and that becomes, even if there's some issue which the hormonal regimen that's present in birth control might be able to affect, it'll be as if, well, that's the first thing we're going to do is provide birth control, rather than doing some of the maybe more challenging work of ascertaining, why are her periods the way they are, et cetera. And, are there other agents that we could use that would not affect the potential for fertility, that would still affect, heavy bleeding, that kind of thing. So, sometimes you feel like there's a sort of tension in the medical profession, especially when it touches on some of these sexual ethics questions.
Other questions that we have? Over here.
Hi, Molly. As an aspiring OBGYN, do you have any tips that you would give as I may go on to deal with having to tell women, oh, you are infertile, but here are some things that we can help you, or I'm sorry, but we can't fix your infertility, but here are some other things?
What a great question. I think one of the greatest blessings I have felt through this whole journey was meeting really wonderful doctors and nurses and medical professionals. I think back to what Father Tad mentioned, I think one of the best things to do is to show that compassion. And I loved your slide about, before telling somebody's mind what the reality of the situation is, like preparing their heart. So I think being compassionate, our doctor, who we ended up choosing to work with, I really felt like he kind of rode this emotional journey with me. He was sad when I was sad. I mentioned we lost our twins. I was at a hospital. This doctor was at a fertility clinic in a different part of town. He came to the hospital to be with me as I mourn the loss of these babies. So that, I felt like he was on my team. In addition to that, I think it was really helpful when people were honest because I think sometimes there's a difference between hope and maybe false promises, so I think the reality is that there's a lot of unknowns in medicine, and it's not always possible for someone to have a baby. So I think having that balance of being hopeful and encouraging, but honest too. I think sometimes, like you mentioned, the fertility industry, you don't want to promise everybody a baby by Christmas, because that, isn't always the case. But yeah, I think just being compassionate, I can already tell that you'll be great.
Okay, other questions? All the way in the back over here.
My question is regarding polycystic ovary treatment. I know in the past people have talked about wedge resection of the ovaries. Question one, would that be considered licit? Question two, are they really doing that anymore? I've heard it's controversial now.
Okay, so wedge resection, first in terms of the ethical question, what you're attempting to do there is to sort of decrease problematic tissue, and the hope would be that this would facilitate ovulation. So to the extent that what you're seeking to do through a wedge resection, cutting out a piece of the ovary, that's going to be a therapeutic attempt and will be allowable. It will not raise any fundamental moral concerns. Your question about the extent of the practice currently, I have to be honest, I haven't run into a lot of it in the work that I do in terms of consultations, where people, they contact our bioethics center. We have a free consultation service, and so a lot of people contact us with infertility questions. But I have to say, over the years, it's been very rare that I have heard of a case of somebody actually going and doing a wedge resection as a treatment for PCOS. So that's all I can tell you from my point of view. Not being an OBGYN myself, I'm not sure if it actually might be happening with a higher frequency, but it seems to me as an outside observer, it may not be a very frequently utilized procedure.
Other questions in the back?
Thank you. I think the question of wedge resection just spurred me to stand up and offer this. I myself had this problem. I had a wedge resection, and as a result, I have 7 children. and I know it's rare, and I wonder if it's rare because it seems so common in the medical practice these days, and I'll address this to the aspiring OBGYN, that they want to resolve things with a pill or something quick. And I have firsthand knowledge of girls who have taken the Clomid for this problem. And I wonder if it's something that we shouldn't rally for in exchange, rather, the bilateral wedge resection. It's a very simple procedure, and recovery is there's no dangers involved, and I think it was a happy solution for me. So I just wanted to share that.
Well, thank you very much. Yeah, I appreciate that. It's fascinating to hear, wonderful to hear, the positive outcome for you.
Okay, additional questions? Beth, we've got one right up front here.
This one is for Molly. I'm just wondering, throughout your time, you said it took about a year to realize that you and your husband needed help. Around that time, or even leading up to it, what was your process like for seeking pastoral counseling, or just words from the church, or any scriptures that specifically helped you in the beginning of that journey?
What a good question. Like I said, it was difficult for me to really open up about this. I have a wonderful parish priest. It was not a conversation I was comfortable having with him. I sought the advice of some other women that I knew who had a similar situation. And then I really did a lot of reading on my own. That was really helpful. And then I also think one of the beautiful things about the church is the saints, and there are so many women who've kind of lived through this whole thing, both infertility and also the loss of a child. And as I read, St. Mary knows what it's like to lose a child. St. Elizabeth knows what it's like to be infertile. And then even beyond the church, there are so many women throughout history. It's one of the interesting things about this issue is that it's universal across time and economic groups and cultures and everything. So I did find a lot of comfort in that, knowing that, I certainly wasn't, even if I felt alone, I certainly wasn't alone going through this journey.
Thank you. Other questions?
Thank you. My question relates to those of us who walk the journey with couples that are facing infertility. Are there any national resources or any templates to start a group in a parish or a diocese to support these couples that are facing irresolvable infertility?
Yeah, there are two. One is called Elizabeth Ministry, and that's actually an international ministry that has chapters all over the world. And that is like a peer-to-peer woman support group. And they actually have, like you're saying, complete guidebooks and guidelines and resources. And then there's a newer one called Red Bird Ministry. And they actually have similar guidelines. They actually have an app and like a whole sort of online support group. So those would be two to check out.
Would they also provide some guidance for parish-based? Because I'm trying to think of anything there that would, how to set up a support group like the one I mentioned in Virginia. I'm not sure that I've seen a template, but have you heard of anything like that?
Yeah, I think most of these organizations have local chapters that are sponsored by a parish. So I think that would be a starting point for you.
Great, thanks. Other questions? Yes.
Hi, so my question is there, Father maybe, in marriage preparation, do you feel there's a role to prepare couples for infertility better? Because I can speak even from when I went through my marriage prep, it was almost, all the talk was about how, with NFP to like you're almost in control. There wasn't as much of a sense of, hey, there's a chance you could be infertile and life is a gift. And I think do you feel there's a way we can prepare couples better?
I do, yes. Marriage prep is a wonderful thing, but it's also a very, limited thing. I always remind people that marriage prep is actually something that extends right back to their childhood. They've been undergoing marriage prep from their own parents, from, other experiences and encounters in the church. But even with that, the actual sort of formal marriage prep that you do with all of its limitations, it's definitely something that I believe priests need to broach the topic. And when I speak to clergy, I always mention that marriage prep is an opportunity to remind people that they may not be able to have a child of their own. The church has very helpful and clear teachings regarding assisted reproduction. And, to say a little bit, to just plant a few seeds there. It won't be possible in the short space of a typical marriage prep to, cover all the ground. But I think we have to make people aware of it. Because I sometimes say to people, and to priests in particular, I'll say, if you hermetically seal this off from your parishioners and you never talk about these kinds of issues ever, where will they go for their authoritative information? How about Cosmopolitan magazine? Places like that. We don't want people going there because they're going to rush them off to the IVF clinic. They're going to be counseling birth control, and all kinds of other problematic directions. So it's important indeed that we use these venues that the church has that interface with people at particular moments like marriage prep.
Yeah, I think it's a great question, and I agree. I think there's a real need for that. Two ways in particular. First, I think when you're thinking about your marriage vows, in good times and in bad, in sickness and health, this, both infertility and then also the loss of a pregnancy, happen so frequently. I think they say like 1 in 4 women will experience these kinds of issues. So, in a group of couples preparing for marriage, there's a very high likelihood that a percentage of those couples would go through that experience. And I think the more knowledge you can have in advance, the more prepared couples will be. So I think that would be a great thing to push in pre-Cana.
Other questions? Right up here up front.
Thank you. I would like to know a little bit more about the relationship between COVID-19 vaccine and causes of infertility for the young people.
Yes, so the question about COVID-19 vaccines and infertility. So my understanding is that there has not been established any kind of data that would indicate that it impedes fertility by receiving the vaccine. However, there was, very interestingly, at one point, a Freedom of Information Act that was rendered against Pfizer Japan. And Pfizer Japan had to release some data about the mRNA vaccines and specifically about the little fat globules that hold the mRNA inside. They had done studies with these fat globules, these micelles they're called, and this is what's injected into you in the mRNA vaccine. And what they did was basically a tracking study to find out where do the micelles congregate or aggregate within a typical human body. It actually was, the ovary was the highest, believe it or not. And the second highest was bone marrow. This is not to say that there's some direct effect on fertility from this, but it bothers me that it required a Freedom of Information Act to force this data out of the hand of Pfizer in order for us to be aware of it. I believe that, vaccines are a wonderful thing, but they require full transparency in the process of development, and any kind of, secrecy like that. This is an important piece of data that should be made available to all women of childbearing age. And it wasn't made known publicly until the Freedom of Information Act. So, I would just offer that as kind of an angle on your question. I have not seen myself any data that otherwise conclusively says that fertility is at risk, but I certainly don't like the idea that women of childbearing age are going to have these micelles accumulating on their ovaries. It seems to me that's a recipe for trouble, potentially.
It might be a good time to mention that Father Tad also sits on the National Institute of Health Fetal Tissue Research Advisory Board. Clearly, when we're doing research related to these kind of things, I think all of us would be agreeing that it might be nice to have somebody like him on that kind of a board. Thank you. Thank you. Other questions? Not seeing any, I'm going to take the moderator's privilege here, and I have a question. Lots of folks go on to the internet to get information. It is probably, to some degree, the bane of our existence as physicians that lots and lots of misinformation is out there. I wonder if you would both comment about the internet, its utility, where it's helpful, and where it might be harmful. Start with you, Father.
I think we ourselves, when we use the internet, need to carry out some due diligence, meaning sometimes check the sources. Sometimes there are footnotes or links to things. Click on them, make sure they look legit before you start telling your neighbors, any of these things. And then, of course, I would mention that there are certain groups, including our own, the National Catholic Bioethics Center, which we have a very extensive website with a lot of helpful information on it. So sometimes it just behooves you to go there, do a few searches, and see if what it is that you're thinking about or looking for information in regard to, whether we have some materials that would clearly and authoritatively also provide you then with something of the ethical guidance that is so often the very battleground of these important scientific questions. So I recommend that kind of care in using the internet and a certain healthy dose of skepticism upon first seeing certain claims presented. Make sure you vet them thoroughly and closely.
Yeah, what an interesting question. I think for me, being a non-medical person, infertility is such a huge issue that there's so many different causes and reasons and methods and treatments, many of which don't apply to me specifically at all. So I think that it can be kind of dangerous to get too deep into internet searches because I know for me, I didn't even have a complete understanding of my own personal health situation. So many of the promises and great ideas on the internet didn't even apply to my situation. So I think it's appropriate to sort of find that balance of educating yourself, but doing that, with the help of your actual doctor too.
So I'm not going to let you get away quite as easily as that. I am concerned too, where people that have a problem have other people saying, I heard that, or I found that, or you should try that. I am sure you got advice from other people, often unsolicited. Would you comment just a little bit about that?
Sure. I think back to your original question about like things you can do to help your own body, I think there are some that are true. I have polycystic ovarian syndrome, which Father Tad mentioned, and there is some truth about diet and lifestyle that affect that condition. But there's also many different opinions about yoga for fertility and acupuncture for fertility and all different kinds of things, which again, I think need to be vetted carefully. Like there can be some encouragement in some of those things, and then there can be a lot of different advice. I chose to not tell too many people about it for part of that reason.
All right, thank you. I think we have another question over here.
First of all, I want to be sure I understand one thing. You presented to us the church's teaching. Don't help the marital act, but don't destroy it or replace it. Okay, and you believe in it. So this is a teaching that the church has had up to now. My question to you is, coming here today, why bother? Because what the church says today, it will not say tomorrow. I mean, I think that many of you know what's going on. If you don't, well, fine. You know what I mean? With the present Pope and those who are around him. They are people who live in the world, and they are of the world.
Thank you for the question. I think, I wouldn't frame it as starkly as you do, because what you're implying is that we would be in a paradigm of complete relativism, that today the church can say that direct killing is always wrong, and tomorrow the church will say that direct killing is just fine. That is not the Catholic Church at all, and it never has been. And with the grace of our Lord Jesus Christ, who guides and directs his church, it never will be. In other words, the church definitively safeguards certain moral truths, and those remain constant, and they are constant right back to the beginning of Christianity. So just to give you an example, the teaching on contraception, many people say, well, that was something new. Church dreamed that up in 1968 when Pope Paul VI came out with Humane Vitae. And it's like, not true. That goes right back to apostolic times. You can trace authoritative teaching that goes back to St. Augustine and prior. So these teachings of the church are not something that is ultimately negotiable. Now, I hear what you're raising, which is a question about, it seems at times that there may be elements of confusion around the way that the church is propagating her message. Maybe that's true. We all need to be better teachers, including perhaps, some who are higher up in the hierarchy of the church. That not everybody has the same set of gifts, but my point is that I don't think it's fair to characterize it the way you did. So the statement about infertility and the church's view that you may assist the marital act, but you may never replace it entirely, that will not change. That has never changed. It was something that, has been part of the consciousness of thinking within the church and only really became sort of a fulminating point with the development of in vitro fertilization in 1978 with the birth of the first IVF baby. And then, it became clear we've got to articulate this reality about human sexuality and plumb the depths here. And people like Pope John Paul II, through the theology of the body, he did a wonderful job of explicating that more fully and completely. So I think in that sense, we need to have a certain reverential acceptance of the beauty and wisdom of Christ's teaching through his church. It's liberating, it's beautiful. Those who throw their lives into it and commit to it experience, a freedom unlike anything else that is out there. And that's a message that our world desperately needs to hear. So to the extent that you think, we as church are not doing it so well, at least you and me, let's do it as best we can. This is so key to share the joy and the beauty of this message.
Well stated. Thank you. Thank you very much.